Welcome to the Healthy Matters podcast with Dr. David Hilden, primary care physician and acute care hospitalist at Hennepin Healthcare in downtown Minneapolis, where we cover the latest in health, healthcare, and what matters to you. And now, here's our host, Dr. David Hilden.
Hey everybody, welcome to the Healthy Matters podcast. I am your host, David Hilden. There are certain parts of our healthcare system that most of us don't even think about very often. They're just there. Steady, reliable, doing the hard work day in and day out. And it's not until something threatens that stability that we start to realize just how much we depend on them. Today, we're talking about one of those institutions, Hennepin Healthcare. For many people, it's known as a place you go in an emergency, and it is that and a lot more. It's one of Minnesota's busiest emergency departments. It's a level 1 trauma center. It's a training ground for future doctors and nurses. And it's a safety net, providing care to anyone who needs it from all over the state, no matter the circumstances. There's some services here that are just not available anywhere else. And right now, that system and everything it supports is facing real and immediate challenges. So today, we're going to take a closer look at why Hennepin Healthcare matters, not just to the patients, but to the entire healthcare ecosystem in the state of Minnesota. And what's at stake if that system is weakened? Joining me today is Susie Emmert, Director of Advocacy and Public Policy, and Jessica Oaxaca, Advocacy and Engagement Manager at Hennepin Healthcare. They both work at the intersection of patient care and public policy, and they work really hard at making sure that what we rely on today is still here for us tomorrow. Jessica, Susie, welcome to the podcast.
Thank you.
Thanks
Dr.
for having
Hilden.
us.
It's good to have you both here today. So let's get right to it. Why is this conversation important right now?
So the reason this is so important right now is Hennepin Healthcare is at risk. We are a level 1 trauma center. We are a safety net. 75% of our patients rely on public programs for their health care. And we have seen, especially in the last year, healthcare being under threat, especially for those Minnesotans who rely on public programs, which inherently means that we are under threat as well if those patients are not able to access their health care in the same way that they were previously. And so we're experiencing a lot of financial challenges, and that's not new for safety net healthcare. Safety net healthcare has always been under threat. As a safety net that serves folks on public programs, we are also expected to fit into the very same infrastructure that all the other hospitals are expected to fit into, really without differential treatment. We're expected to do more with less, even more so than other hospitals are.
Why is that new? I've been here 25 years.
That's not new, but the pressures are different. We've seen inflation in labor costs, equipment costs rising at rapid rates that reimbursement just does not keep up with. And any reimbursement, not just public programs and commercial as well. That's been a major issue. The threat of H.R. 1, which I was here last summer talking to you about after that passed.
Could you just remind us what H.R. 1 is?
Yeah, so H.R. 1 is what passed at the federal level in early July, and that would result in significant changes to the nation's Medicaid program. And for us here in Minnesota, the biggest impacts, and for our safety net health system, are changes to one type of payment called directed payments, and then changes to Medicaid requirements to access the program. So adding additional work requirements and community engagement requirements. Those are going to result in significant challenges to our reimbursement in the next decade. Over $1.7 billion we're anticipating over the next 10 years once those start going into effect. So we're really seeing this kind of key moment where we've already got all these other stressors around reimbursement challenges. We've got inflation and rising costs, reimbursement not keeping up with that, and then this really impending storm that we haven't even been able to really wrap our heads around completely, that's going to have a massive impact. And so while we have always operated on extremely thin margins, these barriers are making it even more difficult.
Yeah, that's a really good summary. So when people hear Hennepin Healthcare, what do they often get wrong or miss entirely? Jessica?
Yeah, I think that's a great question, and something that Susie and I have certainly been talking a lot about with the folks at the state capitol in terms of, yes, we're located in the metro area, but we really do serve as a statewide asset. And it's one of those things that you maybe don't think about until you need some of the specialty care and the specialty services that we provide here. We're a level 1 adult and pediatric trauma center, which is the nation's highest designation, which means that we have the expertise to take care of some of the most complex cases out there. We also serve Minnesotans statewide through the Poison Center, which is located here at Hennepin Healthcare. I know they take calls from every single county across the state of Minnesota. We're the only 24/7 hyperbaric chamber in the region, which is for emergencies. And there are all sorts of reasons that folks end up here at Hennepin Healthcare, but we certainly serve folks from all over the region, whether you live in northern Minnesota or southwest Minnesota and are in an accident that requires some specialty care and trauma. I think we play that role pretty well, and others recognize that.
You know, I know doctors and others that practice around the country, and they're asking me all the time about how you guys are doing in downtown Minneapolis because they have heard about us. They know about us. We have a really good reputation. I'll just use what you said, Jessica, about Level 1 Trauma Center. I know doctors that would tell their patients, if you need a trauma specialist, my suggestion is that you tell the paramedic or that you tell your loved one to drive you to this hospital, even if you have to go by other ones, because we're just so good at that. So it's kind of a big scope of care that we do here in downtown Minneapolis. Can you also touch about the teaching aspects of this hospital?
Yeah, I'd love to. I was just thinking about that as Jessica was talking, all of these different areas where we have such specialty in, we are also training the future physicians and other providers to provide that care. A lot of folks don't think about the fact that when you do training, you're not just training at a school. You need health systems in order to provide that training, and we are one of the primary health systems where training takes place. We operate 22 accredited residency and fellowship programs, and these include cardiology, surgery, emergency medicine, the hyperbaric medicine, burn center, et cetera. All of those have a home here at Hennepin Healthcare. We train a third of all graduate medical education trainees in Minnesota and 60% of undergraduate medical students.
Can I just comment on that?
Please.
So I'm one of those teaching doctors, and I went to medical school over 25 years ago, and you never want to get scooped by the medical student or the cardiologist in training. What do I mean by that? These are smart, well-educated junior physicians. That means their teaching faculty is as current on the latest evidence, the current medical science, the current everything as they are anywhere in the world. When you come to a place that is a teaching hospital, people say, well, I don't want to go there. I don't want to go to a place where someone's learning. Oh, yes, you do. Those are the smartest doctors in the room. Those ones that are straight out of school. What they just don't have yet is experience. What we have then as teaching doctors have all that experience. It's the best place to come to get care. And something like half or more of the doctors in this state trained here. I know a bunch of them. You go up to Bemidji, out to Wilmer, to Duluth or Ely or Benson, Minnesota, pretty good chance your doctor or your nurse practitioner or your PA trained here.
And, 70% of our graduates here remain in Minnesota for continuing practice. You mentioned Bemidji. We have a program with Bemidji where we rotate providers to go to Bemidji and learn different areas. And folks are talking about, could I stay here? And we hear these stories constantly about why folks come to Hennepin Healthcare to learn, and then they decide to stay, not just at Hennepin Healthcare, but in health systems all around the state. And that's not just physicians. I want to be really clear. We provide training across the board to nurses, advanced practice providers, others. Folks want to come here for their training.
What about for getting patient care? Our name is Hennepin Healthcare. Hennepin is the county in which Minneapolis sits, but a lot of the patients come from elsewhere. Do you have any sense about the scope of who gets care here? Just briefly tell us how many patients are coming here from other places?
Yeah, I think for our health system, it's about a third of those folks are from outside of Hennepin County. And so the number one reason that folks outside of Hennepin County come to us is for that specialty trauma and burn care that we're so good at. And I think the other piece I would add to the education training site that we are is also how we help educate other health systems across the state through a variety of different areas, right? So we have the emergency preparedness work that we do with the Metro Regional Resource Center that does disaster planning and response coordination. And we're really looked to across the state for that leadership and coordination in that space through different education exercises. I know when I hear our addiction medicine clinic colleagues also talk about the work that they do is really sharing the expertise that they're able to gain from the innovative work that is happening here at Hennepin Healthcare, and then taking that out to some of these rural communities to help them where there might not be as many providers providers that have that experience and helping set them up so that they can care for their communities as well.
And I think what a lot of people don't realize, and what Jessica alluded to, was we are the safety net for other health systems. They look to us so that they can transfer patients that they're not able to care for in their local hospital. In 2025, we accepted about 1,600 transfers for trauma and other specialty care. That doesn't even count the folks that needed to transfer here for more just, regular medical care for whatever reason, just the trauma and specialty care. And that could be hyperbaric, burn, renal, all kinds of other types of care that their local hospital wasn't able to provide them. And I can assure you, the number of transfers is not a both ways situation. More people come in by transfer than leave. We certainly have certain things that, another health system might do that we rely on, but overall folks are coming to us. A hard decision that we had to make in January was we stopped accepting from health systems outside of Hennepin County for just regular medical transfers. And we have heard from health systems across the state saying, oh, what am I going to do? And that has been a change that we've had to make in order to manage our capacity as we can now in our current financial situation.
The ripple affects the whole state, whole state.
Absolutely. We have really strong relationships with many rural hospitals that have relied on us, and now they are feeling the effects of our challenges.
Yeah, for people living in greater Minnesota, I have such unbelievable respect and admiration for the critical access hospitals and clinics that serve you, but sometimes they need a helping hand from us. That's a really good point about the effect of this metro area safety net hospital on rural communities. Thanks for that, Susie. So we're talking with Susie Emmert and Jessica Oaxaca about safety net healthcare in the state of Minnesota. That's a great foundation for the next part of our show, so stay with us. We will be right back.
When Hennepin Healthcare says, "We're here for life," they mean here for you, your life, and all that it brings. With a hospital in downtown Minneapolis and a network of clinics throughout the metro area, Hennepin Healthcare is here for you and here for life. Learn more at hennepinhealthcare.org.
And we're back. So, Susie, you started the podcast talking about some of the financial considerations around healthcare in Minnesota. What is the role of uncompensated care?
That is a wonderful question and really a significant part of the challenges of running a safety net healthcare system. We are providing care to anyone and everyone who walks through our doors, which we are designed to do. That is why we are here, and we're proud to do that. But when folks do not have health insurance, or they may be underinsured, there may be plans that they're not able to afford anymore with ACA subsidies, or when health insurance policies change, they still need care. So even though their care may not be paid for, they still need the care and they still come to us. And so what happens is we end up not being able to essentially close our budget at the end of the year because we have provided more care than we're able to get reimbursed for. And so we know those numbers are rising over time and have been rising in recent years for all the factors I talked about changes to health insurance. The end of the public health emergency resulted in a lot of people losing Medicaid. They had previously been auto-enrolled through the public health emergency. Losing Medicaid was a significant issue. Changes in, like I said, the ACA subsidy, changes in Minnesota Care, and now these approaching changes in Medicaid are going to result in more uncompensated care because more people will not have health insurance.
Let's move now to what some of the proposed solutions are. So we hear about ballpark taxes. We hear about statewide funding sources. And, so let's focus for a second, if we could, about a different way to fund this healthcare system in the state of Minnesota, that being the ballpark tax. I go to Target Field a lot. I watch the Minnesota Twins a lot. They're going to win the World Series this year. Just mark my words, you heard that. But why are we talking about stadiums and healthcare in the same sentence? What do you mean by repurposing stadium taxes?
The existing Hennepin County sales tax that helped build that stadium is set to be paid off earlier here. And so as we're thinking about some long-term sustainability that we can build for the health system, we were thinking of repurposing that sales tax like other communities have done across the country similarly to help pay for safety net healthcare infrastructure. And so for us, that would mean repurposing that sales tax that is only in Hennepin County, increasing that rate that it currently is at 0.15%, so increasing it to a full cent sales tax. And then the revenue that would be generated from that sales tax would help sustain our safety net health system. Right now, it generates about $50 million a year. And so increasing that rate would help raise about $340 million a year, which, as Susie was talking about, is uncompensated care costs increase. As we have aging facilities and facility needs as well, there is certainly a great need there that we need that scale of sustainability in terms of what a sales tax could help provide.
Yeah, and if a stadium is an essential infrastructure to your community, I would think your healthcare system is even more so. So it makes perfect sense to me that we ought to be funding more sustainably a healthcare system, just as we have a stadium for the future World Series champions.
And I just want to clarify, too, the ballpark sales tax that we repurpose will actually continue funding some of the operational needs of the Twins Stadium.
Of the stadium, yeah, exactly.
Absolutely. It'll help to fund additional healthcare facilities and services in Hennepin County. So it wouldn't just be going entirely to
Not
Hennepin
just this.
Healthcare.
Can one of you answer this question? Why don't we get the money from other healthcare systems? This is a healthcare hotspot of the world. We're as good as they do healthcare in the state of Minnesota. Why can't we just pass the hat, Susie?
Well, I think all of these options have been discussed at length for a long time. Healthcare financing challenges are not new. So these types of solutions have been on the table. There's been talk about, do we raise the income tax? Do we ask other counties to pay for it? We've had these conversations over years about how do we finance our healthcare system. And ultimately, where we are right now, the sales tax feels like the most feasible opportunity we have today to fund Hennepin Healthcare. Jessica mentioned that other communities have used this mechanism. We've got Denver Health, Grady Health System in Atlanta, Cook County in Chicago. Other states have been in similar situations, and they have also used this mechanism to fund their healthcare infrastructure. We have to get really creative here.
Yeah, we're not making something up that no one's ever tried.
Absolutely not. Yeah. Absolutely not. And I think we're all trying to get creative in how we fund our healthcare system, especially with what's coming down the road from H.R. 1. The reason it's so important today, the reason we need to take this opportunity today in Minnesota is our legislature is about to change. We're expecting a significant number of legislators to retire, to change who is in that seat. We're going to have a new governor. Now is the time for a healthcare financing mechanism like the sales tax that will prepare us for what's coming in the future.
Fair enough. How would you also answer people who say that, well, maybe you need to tighten your belts a little bit at Hennepin Healthcare? What are you doing internally to control out-of-control healthcare costs? How do you answer that? Jessica?
I think it's a little bit of both and. It is both about that short-term sustainability and this bigger picture long-term as we're thinking about what's coming down the road. So I know that there's been a lot of different changes here. There's a lot of things that we are trying to do already. There's been various changes, like Susie mentioned, those transfers that we're able to accept if they're not trauma transfers. And then also there's been a couple of service lines that we've had to either consolidate or close down where we can certainly refer to other providers in the community so that we can really focus on what we do really well, like that specialty care that we were talking about earlier. There's been a couple of workforce reductions. There's been all kinds of ideas that I think our leadership are working through as we're thinking about how to really focus in on the things that we do best and making sure that our patients continue to have access.
Yeah, that's well said. As a physician here, I can assure you, listeners, we are tightening our belts. We are doing that. Unequivocally, I can assure you that is also happening. We are trying to be good stewards of every dime that comes into the place. So, Susie or Jessica, when you talk to legislatures, what are you hearing?
Dr. Hilden, it would not surprise you that almost every legislator or elected official we talk to has a Hennepin Healthcare story. From every corner of the state, someone that they know, someone that they love, it could be their child, it could be another family member or friend, they were helped by Hennepin Healthcare. They took the life flight here from whatever corner of the state and they were saved by Hennepin Healthcare and received incredible treatment here. It's not surprising to hear that, and I think that's really where some of our momentum has come from, is people really see the importance of this organization. They see the excellent care that's provided, and they want to be able to do something to save it.
And these are lawmakers from across a very large geographic state, all who are wonderful people who have their own families and businesses and do recognize, regardless of where you are in the state of Minnesota, what a resource we are to all of the state. So what could an individual do to help?
Anyone listening can go to our website and go to our campaign page where you will be able to take action to reach out to your elected officials and tell them how important this is. You can go to hennepinhealthcare.org/howfar so that you can talk to elected officials and help them know how far that we will go to care for them. And now is the time that we need them to care for us and show us how far they'll go for us.
We will put a link to that in our show notes, listeners. But again, that is hennepinhealthcare.org/howfar. Okay, so could you leave us with a word of hope? What gives you hope about what you're doing?
Yeah, I think what gives me hope is all the conversations that we've been having with elected officials. Really, it hasn't, like Susie mentioned, it really hasn't been very surprising to them, the many ways that we serve as a statewide asset. And so I think that recognition that we are important and that we have to do something gives me hope. I think almost every single person I've talked to has said, we have to figure out a way to make sure that Hennepin Healthcare can continue to provide the life-saving care that it does for people all across the state of Minnesota. And I think the other thing that gives me hope too is, even as Susie and I talk to our colleagues about some of the patient stories that they've shared with us, the way that our health system makes such an impact on someone's life, that those stories stick with them years down the road. And gosh, I can't tell you how many different current or former patients that we've had conversations with that have shared with us the different level of patient-centered care that people experience when they come to us. And so there are a lot of folks that have been willing to share those patient stories and their experiences with our health system to share why we are so important and how we were able to make a difference in their lives.
Truly a great message. Susie?
I agree with everything Jessica said. I couldn't say enough about all the wonderful people we've talked to across the state and the providers and workers that we have here in our health system. Something that gives me hope is we are all together in this, and we have seen so much support from our community, our colleagues here. Jessica and I get offers from people on a daily basis saying, how can we help? What can we do? The labor unions that are here are doing an exceptional job showing up and talking to legislators all the time about how much they care about this hospital, and it's really helping. We have professional associations from across the board that all of our providers are members of, and we see just random organizations saying, how can we help? Folks that have a connection to us but maybe aren't even directly involved, who are so concerned about us because they see the impact on the people that they care for. We are just so overwhelmed by the amount of support that we've received from the community of people being really concerned and wanting to do what they can to step up.
I love that. Well, Minnesotans, stick together, and we will do so in this case as well, I'm sure of it. Jessica Oaxaca and Susie Emmert, thank you for joining me today.
Thanks for having us. It was great to be here.
Yeah, thank you.
Listeners, thanks for joining us, and be sure to go to hennepinhealthcare.org/howfar to raise your voice in support of healthcare throughout the state of Minnesota. I'm glad you've joined us, and until next time, be healthy and be well.
Thanks for listening to the Healthy Matters podcast with Dr. David Hilden. To find out more about the Healthy Matters podcast or browse the archive, visit healthymatters.org. Got a question or a comment for the show? Email us at healthymatters@hcmed.org or call 612-873-TALK. There's also a link in the show notes. The Healthy Matters podcast is made possible by Hennepin Healthcare in Minneapolis, Minnesota, and engineered and produced by John Lucas at Highball. Executive producers are Jonathan Comito and Christine Hill. Please remember, we can only give general medical advice during this program, and every case is unique. we urge you to consult with your physician if you have a more serious or pressing health concern. Until next time, be healthy and be well.